When I talk about bioidentical hormones, I always become excited myself because the way I learned about the reason I learned about bioidentical hormones because I developed health problems myself. It was about 15 years ago when I started feeling that my energy level is going down. I couldn't sleep that much. I couldn't get any refreshing sleep, and my productivity went down. And I started thinking that what's going on with me? I was 45-year-old at that time, and I thought that at this age I should be able to work much better, to sleep better, my productivity should be better. And I didn't do anything until I developed heart problems. I developed irregular heartbeats. And it was devastating because I knew how serious it is. So I worked at the hospital at that time. I went to the cardiologist and said, hey, I have irregular heartbeats, do something about it. And they did all the tests. They did the echocardiogram, they did Holter monitor, they did stress test, and guess what happened? They didn't find anything. And I said, what am I supposed to do? And the guy said that you need to take blood thinners for the rest of your life. Can you imagine that? I knew that blood thinners is one of the kind of medications that are tricky because there are too many side effects. And I said, I don't want to do that because I know how dangerous it is. And the cardiologist said, you don't actually have any choice. But I didn't want a drug to control my life. And I started thinking, maybe I have something else I need to do to improve my health and get rid of irregular heartbeats. So I started looking around and talking to people, and I couldn't find any answers. What to do? I didn't have any high blood pressure. I didn't have any structural heart problems. My cholesterol is slightly elevated, so obviously it was not a problem. And I needed to figure out what I have to do because I needed to come up with some solution. And at the time, I realized that in order to help myself, I needed to go really to the root cause of the problem because treating the symptoms, irregular heartbeats with blood thinners is just not enough. And the first time in my life, I realized that treating something symptomatically is probably not the best way to deal with the disease. And I started looking, what else can I do? What is the root cause of my irregular heartbeats? Because there's not cholesterol, not high blood pressure, not structural problems of my heart. So I needed to find out what it is. And I couldn't find any answers. I was talking to people and searching through the literature, and there's nothing at all. So I decided that meanwhile, I can take something like fish oil to improve my heart and continue to look for the possible reasons of my irregular heartbeats. And I think I was just lucky because I started taking fish oil. It was an interesting theory how a monkey became a human being. This theory tells that it was a very clever monkey, and the monkey was sitting on the beach, and this monkey saw the fish. And the monkey thought, why don't I try fish? He grabbed that fish and started eating, and he liked fish. And he continued to eat fish, and what happened is the omega-3 fatty acids from fish went to his brain and made him a human being. I'm not joking, there is a theory like that. So I think that because I started taking omega-3 fatty acids, or maybe some other reasons, I started looking differently at the information I was getting. And when a friend of mine told me that, hey, you are 45-year-old, why don't you check your hormones? And I said, why not? And he said, why not? Let's do it. And I did. And guess what? My hormones were out of whack. So it was kind of clear for me that hormones play important role, and maybe treating hormonal imbalances might be the solution for my irregular heartbeats. But it was actually not in textbooks. What I learned in the medical school or during the residency, I don't even remember anybody telling me that irregular heartbeats can be treated with hormones. I thought that why don't I try it? I don't have any other choice, and I did. I started taking bioidentical hormones, and guess what? I forgot the last time when I had irregular heartbeats. And I mean in the regular situations. So I learned on my own experience how important bioidentical hormones are and what can they do to improve my or my patient's health, energy levels, sleep, etc., etc. Even can solve heart problems, for me at least. And I started introducing bioidentical hormones in my private practice to my patients. And I learned very soon that the support of bioidentical hormones is quite powerful. I remember a woman who came to me, just literally, it was the end of the day, I was kind of tired, and she came, and she was sitting in front of me. She came first time, and she didn't even say a word, but I saw tears coming out of her eyes. And I said, "What happened?" I thought maybe somebody died or something, and she said, "Doc, I'm in a very difficult situation. My boyfriend is threatening to leave me because I have all those hot flashes and night sweats, and I have some other issues. I'm dry inside. He says that he doesn't want to live with me anymore. My son doesn't want to live with me anymore because I am too irritated. I also always answer back and just constantly argue with him. My manager is threatening to fire me from my position because I am not good with the customers." And I said, "Yeah, it's a problem, but what did you do about that?" She said, "I went to my primary care physician, and he said that I'm just going through menopause, and this is natural, and I just need to take sleeping pills, maybe some other psychotropic medication, then I will be fine." But I didn't want drugs to control my life. And I was going to doctor, and just looking for the solution, and that's why I came to you. And immediately this case reminded me about my story. And I thought maybe I should check her hormones. And that was quite simple. We did the blood test, and her hormones were out of whack, and I started giving her bioidentical hormones. And gradually, listen, there are no miracles. There is no miracle treatments like bioidentical hormones or any other. At least I don't know any. Maybe somebody else does, but I don't know any miracle treatments. So gradually, with the support of bioidentical hormones, she started feeling better and better and better, and eventually she got married. Now she is very happy. She is in a very happy marriage. I was told that the guy is very rich. I don't know if it's true or not, but believe me, she is very happy. So I started introducing bioidentical hormones to practically a vast majority of my patients because I realized how powerful the support of bioidentical hormone is. And what is the main ideas that are behind bioidentical hormones when we use it in our practice? First, safety is number one, our concern. Maybe I'm wrong, I'm not always right, but I think there is no really a good management or treatment, whatever it is, that is 100% safe. That's why when I give bioidentical hormones or any other medications, I want to make sure that it's as safe as possible, reasonably safe. So what do we do for that? We check hormone levels on the regular basis to make sure that they're exactly in the optimum range and the hormones are not going too high or too down. And people are asking me, "Doc, why are you checking that? Because if you are giving me the same dose of hormones, it should stay the same way." No, it's not the case. Because in women, postmenopausal women, the estrogen can go up and down. It's called estrogen surge. And when it goes up, when it goes down, nobody exactly knows. That's why we need to monitor the levels of the hormones to make sure that they're in the optimum level. Second, we have a test that can, there is no 100% accurate test, but with good reliability, this test can tell us if we have a problem with estrogen or not. We are using the best labs, in my understanding, the best labs in the United States, so we have that ability. So before just suggesting or prescribing, giving a prescription to a woman for bioidentical hormones, we check what is her body going to do with those hormones. Not, unfortunately, we can't check every hormone, but at least with the estrogen and the rest of some other hormones. So we can determine what might be the outcome. And if the test comes back good, so there is a green light, and I give the woman the bioidentical hormone replacement. But if it's not that good result, then we will sit and discuss the choices we have. There are several choices, and sometimes, most of the time, we can correct it and make it safer for a woman to take estrogen, because we have our own ways to figure out what is wrong, why she's not processing estrogen correctly. We look at the metabolic markers and other markers, and we, most of the time, not always, not 100%, there is no 100% guarantee, but we try to determine what the problem is. And if it's possible, we correct that. The third most important thing is that we try to look at the root cause of the problem. Why this particular patient has a hormonal imbalance. And that's very important, because we need to know why, because maybe we can correct it. And in this kind of situation, we always start looking for other hormones, other than sex hormones, because when somebody is talking about bioidentical hormones, the first thing that comes to everybody's mind is sex hormones, like estrogen, progesterone, testosterone. Look, it's not possible for sex hormones to work alone. There are several other hormones that can influence the action of sex hormones, or just influence the overall well-being of a patient. How about thyroid hormones? Don't you think that thyroid hormones can influence our body greatly in what is it? Yes. Adrenals? Yes. Other hormones, like prolactin, for example. Quite a few patients, they have problem with other hormones, and maybe the reason for that is abnormal growth in the brain or some other reasons. So we need to look into that as well. So we cannot treat the person just for the numbers. We are not treating numbers. And believe me, a lot of patients come to my office with perfectly good results. And they say, "Doc, I have very good labs, but I still feel lousy." And I said, well, that's the common situation. That's why people come to me. And we try to figure out why, what happened, why the labs are good and the patient feels lousy. It could be zillions of reasons. For example, sometimes thyroid hormone is not working properly because the body of the patient can secrete abnormal T3 hormone that occupies the receptor site and prevents the normal T3 hormone to work. Or it could be adrenals. Could be another reason why they are not working, sex hormones including. Every endocrinologist knows that fix adrenals first. And that's what we are trying to do. We try to figure out why hormones are not working, what is the problem, and try to come up with the solution. And always we try to explain why it happens. And that's why we look not only for hormones, but some other things like chronic inflammation in the teeth, the sinuses, digestive tract. Why is it important? Because even digestive tract can influence our hormonal balance tremendously. Let me give you an example. Like 6 months ago, in New England Journal of Medicine, there was an article that really, when I read that, I was just stunned. And why is that? Because when I try to put everything together and make some conclusions, I'm always thinking, am I doing the right thing? Am I doing whatever possible needs to be done, or it's just in my head that I have this explanation, like, digestive system or chronic inflammation? And when I read that article, I saw that actually what we are doing that's what the best practices are. It was a very interesting situation. A lady came to emergency rooms like 25, 27, I don't exactly remember the age. She came to emergency room with altered mental status. And she was put in psychiatric ward with possible schizophrenia. And they gave her psychotropic drugs, and guess what happened? Drugs didn't work. So they started checking her other numbers and figure out that she has a little bit of low thyroid because of autoimmune disorder, and a little bit low of vitamin B12, and a little bit low of vitamin D. But the lady was lucky that the doctor decided that the combination of autoimmune disorder with low hormones and low vitamins is highly suggestive of celiac disease. And so she tested that. She was tested for celiac disease, and guess what happened? The test came back normal, but the doctor was smart enough to say that the test for the celiac disease is not really reliable. Let's do the biopsy. And they did the biopsy and proved celiac disease. And that explained why she had low thyroid, why she had low vitamins, and why she was psychotic as well. So that's what we do. We try to put everything together. We don't treat numbers. We need to go to the root cause, find the best solutions for the patients, and that's the main thing what we do in our practice.